Join us. My name is Brad Woodhouse. I'm the executive director for Protect Our Care. I want to invite our exciting panel, or thank our exciting panel, Senator Cory Booker of New Jersey, Michelle Lewis of New Jersey, who has a healthcare storyteller, and Nick Hare of South Carolina, who's also a healthcare storyteller. Both stories related to pre-existing conditions. I think, as everyone knows who's on this call, this was the first day of Supreme Court nomination hearing of Amy Coney Barrett to the Supreme Court. It created a place in the Guinness Book of World Records for the Republicans for hypocrisy, for even holding this hearing. It defies the polling that we've seen from the public that wants for the next president and the next Senate to pick the next Supreme Court justice. But everyone on this panel and everyone in the hearing today on the Democratic side knows exactly why Republicans, to some of their own potential political peril, they're going against the polls that say wait, are rushing this nomination through. It's not because they couldn't get this nomination done in the lame duck. It's not because they won't have between November 4th and January 2nd or 3rd the same number of senators and have President Trump in the White House. It's because they need their handpicked justice on the Supreme Court on November the 10th of this year to hear the case that President Trump and Republicans have brought to invalidate the Affordable Care Act in its entirety. That's why the rush. They have tried legislatively. President Trump has. The Republican members of the Judiciary Committee have voted in total 48 times to repeal the Affordable Care Act. 48 times. The chairman of the committee has voted 4 or 5 times himself to repeal the Affordable Care Act. This is a healthcare nomination battle. This is, I think everyone knows, going alongside the nomination is a healthcare election. These issues are so critical. I want to thank you, Senator Booker. We have worked with your staff in preparation for these hearings, and Democrats were of one very strong voice about the importance of healthcare, what's at stake and what's at threat in this nomination battle. And I just want to thank you for your leadership and get your perspective on the first day and what's at stake in this nomination battle.
Brad, I can't thank you enough for that kind introduction, but more importantly for the righteous things you were saying. And let's make no mistake, this is what this Supreme Court nomination is about. And you don't need to go any further than what Donald Trump told us what it's about. He has explicitly said that he is going to put a justice on that will overturn the Affordable Care Act. He has not minced words whatsoever. That is his purpose. He has been talking about the Affordable Care Act far before he was president of the United States. He came to Washington, tried to do what a lot of the Senate Republicans and House members have tried to do, which is to overturn it. But he failed. In his frontal attack, he failed, thanks to a handful of Republicans who joined, like John McCain, who joined Democrats in protecting it. Then he spent a lot of his years not only attacking it by failing to keep the advertising going to get more people into the marketplaces, doing things like cutting funding to it that helped to push up premium costs. He's constantly been attacking it, but one of his plans from the very beginning was to attack it in the courts and to put as many justices as he could. And he right now, I think, has the record in the modern era for putting justices on the federal court, putting justices on that would do his bidding. And finally, he's gotten to this moment right now where he is putting a justice that will do what he said, which is to undermine the Affordable Care Act. And this is the crisis that we're in right now. We see that not only are they doing that, but as was said by you, Brad, they're doing it in the most hypocritical of ways, because when we were 269 days out 4 years ago from an election, Republicans denied Barack Obama the ability to put Merrick Garland on the court by saying that the people should decide. It was an election year and people should decide in an election. Well, here we are, not in an election year, It's not even election time. People have already started voting. Millions of Americans have started voting. Here we are, 22 days out from an election, and they're trying to jam this nominee through for the exact reasons that Brad said, is to get her seated on the court in time to hear oral arguments less than a month from now. And that oral arguments, to be specific, it's in the case California versus Texas, which is whether they will invalidate in total the Affordable Care Act and put the health care of millions of Americans in jeopardy. About 500,000 New Jerseyans in jeopardy. This is wrong. This should wait until after the election. We have to make sure that we let our voices be heard. Now, look, I had the chance to talk about New Jerseyans today, and I'm so happy that Michelle is here. Michelle is not only from New Jersey, she's from my home county, Bergen County, and she, in fact, just a few towns over from where I grew up. And I'm grateful that she is here to tell her story, which is really a very American story. And I don't want to take any of her own testimony, but I want to say that when we throw things around, like these numbers of people that will lose healthcare, each one of these people is a family member, a community member. Each one of these folks is a fellow American. We are the wealthiest nation on the planet Earth. The least we could do is make sure that everybody has a pathway to quality, affordable healthcare, especially in a pandemic. And so we are in a moment of urgency, where literally we are now at a crossroads. After putting in the Affordable Care Act, expanding healthcare for tens of millions of Americans, we now are at the precipice of a president accomplishing what he's been trying to do for the last 4 years, what Republicans have tried to do for the last 10 years. We cannot allow this to happen. We all must speak up. And with that, Brad, I'll turn it back to you. So you're perfectly sandwiched between two New Jerseys.
I can't wait. I've actually spent a lot of time in New Jersey recently. Thank you, Senator Booker. I want to thank you for your, as I said, for your leadership. And as you saw that, the Democratic side of the committee room today, and you saw all the posters, all the stories, every single member talking about the importance of health care. And there are a lot of Republicans that'll, including the president today, tweeting, well, we'll protect people with pre-existing conditions. The Affordable Care Act is the gold standard of gold standards for protecting people with pre-existing conditions.
Brad, let me interrupt you because he has had 4 years to put forward his plan.
Right. 4 years.
4 years to put forward a plan. He hasn't done it. He's told us literally 2 different occasions. He told Fox News, my plan's coming out in 2 weeks. Another time, my plan's coming out in a month. It never has come out. That's why John McCain joined with 2 other Republicans, because you can't repeal something and have nothing to show that you're willing to replace it with. So lip service is not enough for me and not enough for a lot of Americans.
Oh my gosh, I don't want to belabor this, but I mean, the biggest lie the president tells, one is on pre-existing conditions, but then it's the broad one where he said today, we're gonna give you better health care at a lower cost. I mean, there is no such thing as better than the Affordable Care Act, also at a lower cost. I mean, it doesn't make any sense. It's disingenuous, and that's a kind way to put it. But thank you, Senator Booker. Michelle, I couldn't give you a better introduction than the senator did. You are from New Jersey. You're a constituent, and you have a very important story to tell. So please share it with us.
Thank you. Good afternoon, and thank you for having me. My story begins a year ago when my marriage, I was married for 35 years, and my husband suddenly passed away. Within days, I realized that I wasn't going to have health insurance, so I immediately picked up COBRA and saw that the premiums were just too high. I wouldn't be able to afford them going forward. And not only that, but COBRA is limited. It's only for a certain amount of time. 5 years, I'll be eligible for Medicare, but I'm only 60. So as a 60-year-old woman with pre-existing conditions, I'm an insulin-dependent diabetic, and I have some other health issues. I realized I needed to find affordable healthcare. I went on healthcare.gov. I found a plan that covered all of my needs. The premiums were affordable, covered my prescriptions. I was able to get my insulin. Everything worked out great, and I can't tell you what a godsend it was and just how relieved I was that I didn't have to worry about whether I was going to pay my mortgage that month or I was going to have to pay my health insurance premium. That's really what it came down to. Could I lose my house? I've worked hard, 35 years, my husband and I, we saved, we worked, I have a home, and all of a sudden in one day, my health insurance was gone, my husband was gone, and I had so much else to deal with. I didn't want that to be something else, that I had to deal with. It could be financial ruin for anyone, and it could happen to anyone. So I was on the plan for a year. It's been a year now for me that I've been on the plan, and I just can't tell you how wonderfully it's worked. I'm able to pay for everything. I don't have to worry about it. Everything, all my needs have been met medically, and it's just a relief. And the thought of that ending and me going back to that horrible, scary place, which is terrifying, to think that I'm not going to have health insurance that I can afford, I don't know what I'm going to do. It'll literally ruin me financially, or I'll just choose not to have health insurance. And how horrible is that? It's really inhumane and immoral to repeal the ACA, and I'm terrified that it's going to happen. I thank Senator Booker for hearing our voices and for fighting the fight for us.
Michelle, thank you for that story. I know Senator Booker knows this. I mean, it's your story is what propelled the momentum behind passing the Affordable Care Act in the first place. It was stories just like this. It was stories about denial of coverage. It was stories about how expensive coverage was. It was stories about medical bankruptcies. And so I'm so glad you're getting adequate, good, strong coverage out of the Affordable Care Act. And I know Senator Booker and his colleagues and our organization and all types of organizations that are involved in this fight are going to fight like hell to make sure that you not only get to keep what you have, but that we strengthen it after this election. So thank you so much.
Thank you. I can't thank you all enough.
Yeah,
thank
you so much for your story. Let me now turn it over to Nick Hare. Nick is from a state dear to my heart. I'm a graduate of the University of South Carolina, though I grew up in the Tar Heel State. But you are a constituent of Lindsey Graham, who is the chair of the Judiciary Committee, a longtime proponent of repealing the Affordable Care Act. Incidentally, I know Senator Booker remembers this. Chairman Graham, along with Senator Cassidy, had the last best hope that Republicans had in 2017 in terms of legislation to repeal the Affordable Care Act. It was called the Graham-Cassidy bill, or the Graham-Cassidy proposal. And at that point, after Senator McCain had already provided the critical vote to vote down repeal in the Senate, repeal had become so unpopular that, of all people, Mitch McConnell would not put Graham-Cassidy on the floor of the United States Senate. He could not get votes even among his caucus for that. So Senator Graham, who is chairing these hearings and is ramming this nomination through, is central to the story of Republicans trying to take away health care from the American people. But Nick, let's hear your story. You also suffer from a pre-existing condition, have been out of work, and in a possibility where the court strikes down the Affordable Care Act, you would be left out in the cold.
So first of all, thank you, Brad, for having me. Thank you, Senator Booker, for your work, and thank you, Michelle, for sharing. So my story also kind of recent within the past year. At Christmas Eve, I was diagnosed type 1 diabetic. I've always lived a very kind of healthy, active lifestyle, so it took myself and kind of everyone around me really off guard. It was a scary kind of time, but I got through it, and it's managed now. But luckily, at the time, my employer was providing me with great health insurance. But as the 2020 ball would roll, I was laid off due to coronavirus cutbacks by the software company I was working for here at Charleston. On kind of the same day, the house I was renting got sold, and so all of a sudden, kind of my beginning of my summer took a real turn. But you know, I elected to go on to Cobra just because at the time I was pretty mentally exhausted from the whole situation. And I knew that maintaining my current plan through Cobra would at least cover my wearable continuous glucose monitor, which without any health insurance is about $700 a month and probably cost $8 to make if I had to take a shot at it. But yeah, no, I mean, that's kind of my recent story in a nutshell with regards to this conversation. And kind of, you know, I knew nothing about type 1 diabetes prior to this, and I really knew nothing about health insurance prior to my monthly, you know, pharmaceutical costs going from $0 to $1,500 a month. But as I've learned so much in this past year, and, you know, becoming type 1 diabetic at 32 years old puts me in a small minority of people, but the majority of those people are 8-year-old girls pricking their fingers 5 times a day, right? So the idea of coverage for pre-existing conditions being eliminated in my mind is not only like cost prohibitive to people who have them, but immoral in a sense, because those are the conditions that you're putting people in much worse shape than myself at risk of dealing with. And I'll kind of throw it back to you, Brad.
No, Nick, thank you. And I appreciate your story. I mean, and as Senator Booker will recognize, I mean, you're the type of story where, you know, you were rolling along in life and you had employer coverage and you didn't have a pre-existing condition. At that point, you had not been diagnosed with type 1 diabetics. You probably the Affordable Care Act was the furthest thing from your mind. But as you see now, and by the way, you have another story to tell. I don't know exact circumstances around your layoff, but we've seen an economy that's been devastated because the president has mismanaged the federal response, the nation's response to the coronavirus pandemic. He played it down. He didn't share with us how lethal it was. He didn't share guidance with us that it was airborne. And so you're a victim of both their attempts to take away American healthcare, and also likely a victim of his disastrous response to coronavirus. And I got to say, Senator Booker, I don't think if you wrote a script where they tried to repeal the Affordable Care Act, they lost the House of Representatives over the issue in 2018, yet they continued to pursue that policy. The president continued to talk about it and advocate for it. They continued to try to do it in the courts. They try to sabotage it administratively, and then they continue to do it in the middle of a pandemic. If you went and took that script to Hollywood, they would say, well, that's crazy. That no one would ever do that. They would not follow one political disaster for them with another political disaster. And I think the whole thing is political suicide. But the problem with it is that they have a very real threat to American healthcare in this case. And I remember in 2018 when this case came up originally, and people said, don't worry about it. It's crazy legal theory. Never go anywhere. Well, right now it's going to be heard by the Supreme Court on November 10th with possibly another justice appointed by an anti-ACA president. So before we go to Q&A, I'd just like to reflect on that and a little bit of what you've heard.
Well, first of all, I was with you. It's so funny you say that. I did not think that this case would go anywhere. But then the United States Justice Department, imagine this, the Justice Department, the lawyers for the people on the federal level actually were the ones that were driving this case all the way to the Supreme Court, a case to strip healthcare away from people. I mean, that's what the problem is for me, is that they're not even hiding it. They're just literally saying, we are going to take this law down, which will send us back not only to pre-existing conditions, lifetime caps, the ability to stay on your health insurance, the ability to not be discriminated against for being a woman and charged higher care, a lot of the essential benefits that are now a part of the Affordable Care Act. There's so many elements that we are taking for granted almost for what we've had for this last decade that have really stopped your destiny from being controlled by health insurance. And the last thing I'll say to the comment made earlier is most of us as Americans often don't really know how good our healthcare is until we need it, or until it's taken away from us. We don't realize that we're just an illness, disease, or an injury away from having a serious crisis, and that health crisis should not be matched by a financial crisis. You know, when I read, Michelle, your story today, I kind of tripped. I got emotional over those lines about losing your home. And just people don't think about the kind of
Very real.
yeah, very real that you would go into if you lose it. So this is what gets me is when you talk about the Republicans doing this and what the consequences will be. If there are no, like the first step for me is to stop it. Maybe we can still. I was surprised by John McCain, frankly, at the beginning of Donald Trump's term, who was that one person that was morally moved, joining two other Republicans to save the ACA. So the first thing, all we need is one person on this committee to change their mind, or two people on the floor of the Senate to change their mind. Absent that, the only way we could ever defend health care is if we control this election, if we vote, and Democrats who will stand up and commit to health care and find a way with the Democratic president to do something about it. So I hope you're right. I hope that, I don't care what your party is. The one thing I love about Bergen County, New Jersey, where I'm from, is it's a very purple place, you know. And I grew up in a majority Republican town. Good people who care about each other, who know the richest nation on the planet Earth shouldn't have people going bankrupt because they can't afford their prescription, their health care, or putting aside life-saving drugs like insulin.
Right.
They can't afford it. And so I just hope people remember that no matter what. Remember that we are still arguing in 2020, trying to defend gains that we made years ago, and that's just wrong.
Great. Thank you, Senator, and thank you to this entire panel. I think with that, my trusty aide, Mitch Harrell, who is in one of these boxes, is going to open it up.
I can't put Mitch in a box, man. Like, terrible, man.
Put him in a box.
You don't put Katie in a corner. You don't put Mitch in a box.
You don't put Mitch in a box. Mitch, you're welcome to show us yourself if you want to, but can you explain to reporters how they can chime in if they so choose?
Yeah, so good afternoon, everyone. Like Brad said, my name is Mitch Harrell. I'm with Protect Our Care. And if you have a question for either Senator Booker, Michelle, or Nick, there is a hand raise feature that you can see, and then I will give you the ability to talk and ask a question. And I'll be able to say your name, but if you could also just tell us what outlet or publication you're from, that would be great. So our first question is going to be from Nicholas Wu. Nicholas?
Hi there. Can you hear me?
Yep.
Cool. Hi, this is Nicholas Wu with USA Today. I've got a question for Senator Booker. Over the weekend, Leader Schumer said that he wanted Democrats to prevent Republicans from getting a quorum on the committee and on the floor. Are you planning on boycotting the vote in committee and on the floor?
So I have not discussed that with Senator Schumer whatsoever. I have no plans right now beyond my questioning tomorrow, which, to be quite frank with you, knowing that I have 30 minutes, maybe if we get to the 20-minute round, to really question this nominee. I'm focused on that right now. So I'm sorry that I don't have any response to you. I've just really been focused on today and tomorrow.
Got it. Thanks.
Thank you, Nicholas. Mitch?
Okay, so next up, we've got Jonathan Salant.
There he is.
Okay, Jonathan.
Hi, I just unmuted.
Yes, go right ahead.
Thanks for doing the call. It's Jonathan Salant from New Jersey Advanced Media. Senator Booker, you were at the last confirmation hearings and with Kavanaugh, and you had a major role in it. What's the main difference between these hearings and those hearings? Do you expect another time where you uncover all sorts of papers like you did the last time, a major moment?
I think that the biggest difference is that we're 22 days out from an election, and that this very process goes against what my colleague said quite plainly. Lindsey Graham invited us to use his words against him, that he would not put up a justice this close to an election. And so, Judge Barrett is not, is to me not the issue as much as the illegitimacy of this process and trying to push a nominee through who was clearly intended to kill the Affordable Care Act, truly intended, as Donald Trump has told us, to end this piece of legislation, as well as other things that Donald Trump has told us. So again, I just want folks to understand that this is not right. This is not normal. It's never been done before in American history. The only time we've had a Supreme Court justice die this close to an election was during Lincoln's administration. And what did President Lincoln do then? He did nothing. He did not put someone up. He respected that reality that the people were about to speak. And the thing that I didn't mention earlier that I will, which is just like, this is the majority of America. Like, we're talking about close to 75% of Americans think we should wait. I don't know if 75% of Americans agree on like that they like chocolate ice cream, for crying out loud. I mean, this is a huge majority of Americans that think that we should wait until after this election, until after the next inauguration before we go forward. And if American people are allowed to speak about their health care, I'm confident that they would speak out against what this president is doing, because clearly not only does 75% of America think we should not be going forward, but about that same percentage believe that the Affordable Care Act should stand.
If I can ask a follow-up, are you doing anything differently this time than you did for Kavanaugh?
Well, Kavanaugh had a lot more time to study and research. This time I don't. We're moving at a lot faster of a clip than we were last time. And it's unfortunate that we are trying to jam this through as opposed to waiting. And again, the other thing that I'm doing that I wasn't doing last time is wearing a mask during a committee hearing. That speaks to the fact that we are in the middle of a pandemic, and that this is yet another reason, if Mitch McConnell doesn't think it's safe enough for senators to be on the floor of the Senate. Remember, he suspended the Senate, and with the exception of this hearing. And so again, I have some questions about all my colleagues being tested, reporting those tests in, because clearly we saw what the honor system did in the last debate with the president who was likely infected at that time. So there's so many things wrong about this. And as I said at the end of my comments today, Jonathan, this is not normal. This is just not normal. And it's ahistoric, and it should not be happening.
Couldn't agree more, Senator. Mitch, continue with questions, if any.
Okay, our next question is going to be from Bob Hennelly. Bob?
All right, Mitch, I don't see Bob popping up.
Is that a pun, man, Bob?
Exactly. You're good at this. Why?
No.
Your staff must just love this. Like, it goes on all day long.
Hello, it's Bob Henley. Hello.
Oh, there he is. There he is.
Hello, Senator Booker. It's been a long time.
Bob has one of the most recognizable voices in New Jersey. His face, however, he can still go to the supermarket without being recognized. But
Exactly. You're very kind. I wanted to ask you, throughout the COVID pandemic, it's been portrayed as something that either kills you or you survive. As thousands of first responders, healthcare professionals, and essential workers and their families have all learned, surviving can mean chronic illness, even lifelong disability. Wouldn't overturning ACA mean that these heroes and the family members they may have infected will lose the pre-existing condition protections they'll need so they can stay healthy?
Yeah, Bob, I'm so grateful you brought that up. I did not speak to that in my opening remarks today, but yes, we now know that having COVID, because of potential lifelong complications with your health, is a pre-existing condition. And therefore, with a nation that has had hundreds and hundreds of thousands of Americans infected, should we lose the prohibitions against denying coverage for people with pre-existing conditions, it puts at risk all of those folks, including the people that had to go out to work to try to save us, first responders, hospital workers. And now we see this with infection rates affecting teachers who are in our schools. So many of those Americans that we lauded for their sacrifice and their service are the very ones that are most at risk of losing health insurance because of COVID, which is now a pre-existing condition.
Maybe permitted a follow-up?
Please, I'm sorry, Brad's show.
In my capacity as a reporter for the chief leader that's been covering the civil service since 1897, historically, the United States has memorialized our war dead in every village and town for all of our armed conflicts. Would you support the compiling of a national list of first responders and healthcare workers who died while helping combat COVID. Wouldn't this be a way of not only honoring their sacrifice, but to hold us accountable for the national failure to protect them and ourselves from this contagious and deadly virus?
Sort of apropos of your question, when we lost the first responder in New Jersey, a firefighter to COVID, a firefighter named Israel Tolentino, I reached out across the aisle to write a bill to make sure that his survivors would get the benefits that they were due to them as if he had died in the line of duty. And in the midst of a pandemic, when you are doing things as brave as our police, firefighter, EMTs, other first responders are doing, we should find a way to acknowledge their sacrifice and their service. This is the fourth largest mass casualty event in American history, followed by the Civil War, World War II, then the pandemic of 1918, and then this one. We most certainly should find an appropriate way to honor those people who put themselves in harm's way and ultimately met their demise in service of their nation and their fellow Americans.
You would agree, though, it also helped hold us accountable in future generations because this didn't need to happen.
Bob, I couldn't agree with you more, and I just want to say that future generations will look back at this moment in American history as one of the great shameful failures of American leadership, that we should be such an outlier on the planet Earth. I mean, just look right up at Canada, a dramatic fraction of the infection rates and deaths that we have because of just different leadership. This has been a failure, a colossal failure of the Trump administration that would go so far as to flaunt basic security protections like wearing a mask. This has been a terrible, terrible failure in leadership. And yes, we should do things to acknowledge to future generations and warn them never to let this happen again.
Thanks,
Senator. Thanks, Bob. The senator to your left in the hearings, I think, said it right in the vice presidential debate when Senator Hare said that this administration's response to coronavirus is the worst response of any administration in American history to a crisis. It is damnable. With that, Mitch, do we have additional questions?
Yep, looks like we have one more question from Mary Ellen McIntyre at roll call. Okay, Mary Ellen.
Hey, Senator, thanks for doing this. I wanted to follow up on what you said about having some concerns about your colleagues who had previously tested positive for coronavirus. I know you've called for, a testing regimen for the committee this week. What are your concerns? Are you concerned that they haven't provided a negative test since returning to the committee? Are you unsure about the note that Senator Lee put forward from Dr. Monahan today? Could you elaborate on that a little bit?
So my specific concerns are this. We are in the middle of a pandemic. At least 2 members of the committee have been infected. We do not have any universal testing protocols to be in an enclosed room for hours at a time with staffers around us that other Senate workers will have to operate in, that we don't have established protocols of safety or testing protocols to ensure that all who enter and exit don't have the COVID virus. This is clearly problematic. And again, Mitch McConnell made a safety decision, it seems, to not have the Senate convene right now, as many senators who were, or at least a handful of senators who were at that super spreader, what seems to be at what was a super spreader event. So yeah, I have some concerns that there was no protocols being spelled out that I think adequately protect not just the members, frankly, but for all the dozens and dozens of people who are involved in this multiple day hearing in that enclosed room. And there are definitely people that are at high risk. I'm not just talking about my colleagues, but there are people that are high risk that are being pulled into this without any knowledge or security. Not even just having universal testing seems to be a failure.
Well, and correct me if I'm wrong, Senator Mary Ellen, you may correct me, but I understand that Senator Cruz was remote today or participated in the hearing virtually because he quarantined himself after being exposed to Senator Lee, who tested positive, but Senator Lee attended the hearing. So, it doesn't appear that that Republicans have any consistency or, frankly, regard for the spreading of this virus. All you need to do is look at the event at the White House, which included a significant indoor portion that we now know. A lot of people came down with the virus. The president was either had it then or contracted it and later tested positive. I mean, it just goes in the annals of Republicans, with the president being the top Republican, not taking this seriously. And now we're into 215,000 deaths in the worst economy since the 1930s. Mitch, I think you said that was the last question.
Yep, that's it for today.
All right. Well, thank you. I didn't mean to put you in a box, but I will definitely report to Senator Booker that we have taken you out of that box in short order. Well, I want to thank this panel. I want to thank you, Michelle. Thank you, Nick, for your stories, and Senator Booker. You know how much we appreciate you and your service and your team and all the work that y'all did to really have such a strong Democratic message on the first day of these hearings. And I'll turn it over to you for a last word.
My last word is out of gratitude. I think that more powerful than a senator's voice right now are the voices of Americans. As we did during the first battle to preserve the Affordable Care Act, we saw tens of thousands of Americans stepping forward, letting their stories be heard, letting their voices being heard, appealing to the moral moment that we're in right now. In a nation that professes the ideals of life, liberty, and the pursuit of happiness, we should not have people that have their life compromised because they can't access affordable care. We shouldn't have people who have their liberty stolen, where they're chained to fear, where they're chained to insecurity, and their pursuit of happiness completely undermined by financial disaster or health crisis because of a lack of affordable care. So today I'm especially grateful, Brad, for you convening this, and I'm especially grateful to Nick and Michelle for being willing so courageously, frankly, to tell their stories. Michelle literally allowed me to put her picture up on national TV, and I'm grateful for that act of spirit generosity. And really, I know it's not just about, Nick and Michelle aren't just doing it for themselves, they're doing it for all Americans, because they don't want other Americans to face the challenges that they faced or will face should the Affordable Care Act fail.
Great. Thank you again. Thank you, Nick. Thank you, Michelle. Thank you, Senator Booker.
Thank you.
Keep up the fight. And thanks to all who joined us. And we will close this call, and we will be back in touch soon.
Amen.
Thanks, everybody.
Thank you.